Hello, hello, and welcome to episode 3 of Awkward Moms. I must say, it has been a journey getting this recorded. This is my third take. It's just been a journey today. I had a long day at work, and then I came home and said, I'm going to dive right into recording. And yeah, this is my third take. It's been hard to get this recorded, but we got it. Okay, so on this evening, I wanted to discuss therapies and different forms of therapies for neurodivergent kids. And I just kind of wanted to dive into what each therapy is and what they mean for your child and kind of give some definitions of what they are. I feel like a lot of times you take your kids to these therapies and you kind of look at it like, okay, they say they have to have this and they say they have to have that, so I'm going to do it. But a lot of times you don't really understand or know what each therapy is. So it's important to know what you're taking your child to and know the definition of it and know what to expect. So I kind of wanted to dive into that on this evening. Two little housekeeping things really quick. Number one, again, my sister made this shirt. She's Courtney Jones on Facebook. She made this shirt for me like a year ago, I think. And as you can see, it's still good. She made it and it matches my earrings. So again, Courtney Jones on Facebook, reach out to her if you want your autism shirts. Secondly, like, share, subscribe. Like, share, subscribe. Like, share, subscribe. Please. The only way that I'm going to get this out there to other people that I can't reach is if you help me reach them. So please like, share, and subscribe. I'm on TikTok. I'm on YouTube, of course, because this is where it's going. I'm on Facebook. Share, like, subscribe. I'm trying to get out there. I'm trying to help as many parents as I possibly can, and I need your help to do it. Help me, help you, help other people. Please, please help me. So like, share, and subscribe, please. So let's go ahead and dive into episode 3 because again, I've recorded this 3 times. So let's dive into episode 3. The first form of therapy I have is speech therapy. Speech therapy is a treatment that improves your ability to talk and use other language skills. It helps you express your thoughts and understand what people are saying to you. Speech therapy is a major one, especially for autistic kids, and I imagine Asperger's too, because a lot of them start off nonverbal, and some never stop being nonverbal. So speech therapy kind of helps them to express themselves. What I found interesting about speech therapy that I never knew was they teach sign language as well. And the thing is, they can't say what they want to say. But if you teach them different signs that they can use, that kind of helps them to express what they want to express. So I found that to be interesting. It's kind of like a deaf person. They can't hear themselves talking. So to them, they may think that they're saying what you're saying, but ultimately they're not. You can't understand what they're saying, so they sign. So same thing with a nonverbal child. If I teach you how to sign, then you can express what you need to express. So that was something that I found to be interesting about speech therapy. Also, I remember when I worked at my old job, a lot of parents would sit up there and talk to me, and they would say that they didn't understand like why speech therapy is just kind of seems like they just come to play, and they don't. You have to understand the dynamics of it. A lot of times they watch your kids and they see what your kids enjoy. You have your kids who love blocks. You have your kids who love dinosaurs. You have your kids. They have each toy that each kid loves because they kind of all have their thing and they're kind of like the same things. For example, my child still loves cars. We were sitting at the food table, sitting down eating with my sister Tuesday, and I was watching my son, and still at his big age, now learning how to drive a car, he still carries his cars around and he still plays with his cars at the dinner table. And again, he's at a driving age and he's still carrying those cars around. So um, they kind of listen or pay attention to what the kids like. For example, one of the main things that I saw them do was blocks. and they would dump the blocks out and play with the blocks. But as the kids are playing, because in the kids' head they're just playing, but what they don't know is that they're learning. So before you know it, your child is saying block. Before you know it, your child is telling you that block is yellow. Before you know it, your child is telling you that that block is red. So it's teaching them on their level, because you have to know how to go where they are. So it's teaching them on their level. Even a lot of what I've learned also is a lot of autistic kids especially love music. My son still loves music. Before I started recording, I had to tell him to turn his music off. They love music. So putting their music on the TV and having the videos playing and them kind of dancing to the music, they're learning. They don't know they're learning, but a lot of the videos that they would play would teach them things, teach them sounds, teach them certain things that they needed to know in order for that vocabulary to come out. So to the parent, it may have seemed like they were coming to play, but no, they were learning. They were just learning on their level and in their way, because they don't learn the same way we learn. So sitting in the office with the speech therapist was always interesting. I always learned a lot about speech therapy, and I love to watch it. And I love to watch how a nonverbal kid would come in at maybe the age of 3, not giving us any words. And then I would say in a 6-month period, words are coming out, vocabulary is coming in. And it's kind of like, see, mama, you thought that they're just coming to play, but no, they're picking up vocabulary. So speech therapy is a vital um, form of therapy. The next one I have is ABA therapy. It is the most popular therapy for kids on the spectrum. It focuses on encouraging and reinforcing positive behaviors while discouraging negative ones. I said on, I think the last video may have been the first one, that a lot of autistic kids, what comes up comes out. Whatever they're thinking, that's what's gonna come out. They don't know that don't need to say what they think. They don't know that they don't need to say something that's gonna hurt someone's feelings. They don't know. They don't know they know what they're saying, but unless it's taught, they don't know that that's not okay. So that's one of those things that ABA therapy teaches. It also teaches positive behaviors, as far as when your kids throw tantrums, when your kids act out, when your kids some kids, they, I think I spoke on last week about the kid that punched their um hand through the window. They don't know, so they just act. And so ABA therapy teaches or reinforce, not only teaches but reinforces the right behaviors. Another thing that I found interesting about ABA therapy, and I didn't learn this until working in it. It also teaches directions. If I give my son 3 directions right now, he's only going to do one. If I say, Gavin, go upstairs, well, 4 directions. If I say, Gavin, go upstairs, go in your room, look in your closet, and bring me that green shirt, I'll never see that green shirt, because he's only going to do one of those directions, maybe 2 on a good day. But I myself would never see that green shirt. So it's something programmed. Again, I don't know how their minds work, but it's something in their minds that's like, I got one direction and that's it. That's it. I might have got 2 on a good day, but that's it. I don't have the rest of them. So ABA therapy teaches those directions. I would have a child come up to me, Miss Brittany, what's your favorite color? And I would ask them, what direction are you on? This is step 3. And I loved it, because I'm like, they follow each step. And that's one thing that I loved about ABA therapy, because that was something that I didn't know the importance of raising my son. I didn't know the importance of, he took a little ABA therapy in school early, but I didn't know the importance of ABA therapy and how it would teach them about directions. But I also didn't key in or pay attention to um him not being able to follow the step-by-step directions, because I would just give him a direction step by step, or I would just do it. So that's also an important factor with ABA therapy, because hey, they have to become adults and they have to learn stuff. They become older and they have to learn how to take different directions and be able to take multiple directions, because everybody's not going to give a direction step by step. So that's also the importance of ABA therapy. But what's unfortunate about ABA therapy is they're listed everywhere because so many kids need ABA therapy. There are lists everywhere, and the lists are extensively long. And that's the one thing that I hate. I would have parents call me, "Hey, Brittany, what number is my child on the list today?" And I would have to say, I honestly don't know, and I honestly don't know when your child can come because the list was always long, and it really just bothered me. But there's nothing that they can do because you have to have the resources, and you have to have enough resources, and it also takes funding. It takes a lot of things that plays into making sure that you can offer those therapies to multiple kids. So it's one of those unfortunate things. But I've also had parents who traveled. I had parents that went to Valdosta, parents that went to Tallahassee. I saw a parent that went up to Atlanta. Like, you have to do what you have to do for your kids. You have to be your kids' advocate, and you have to do what you have to do. So if that means traveling for your kid, then hey, this therapy is important. So we got to travel. We have to do what we have to do to make sure our kid is good. So ABA therapy is one of those great therapies for kids on the spectrum because they need it. They need it. It's not a kid that's on the spectrum in the world that does not need ABA therapy of some form. So that's a great therapy. The next one I have is cognitive behavior therapy, an effective treatment approach for a range of emotional health issues like anxiety and depression. Um, this therapy I felt was vital because a lot of these kids don't understand why they're different. They don't understand why they're not like the rest of the kids. They don't understand it. And we have to figure out ways to explain it to them. But I think sometimes we find difficulties explaining it because we don't even know. So I think this form of therapy is very helpful, especially once they hit those teenage years, because I was terrified with my son going to the high school. Because although, he may have experienced it some in elementary, middle, whatever, high school is kind of that place where they start to find they start going through hormonal changes, they start to find their independence. Nobody's not walking you to lunch. You're walking to lunch by yourself. No one is walking you to class. You're finding your classes yourself. So I feel like high school is like a big thing. And so I was nervous because I was like, I don't want him to regress. We've came so far. And I didn't want him to regress, or more importantly, go through, a place where he was unsure about himself and had uncertainties about himself. That causes depression. And so, cognitive behavior therapy, I feel, is vitally important as well, even for smaller kids, because smaller kids have questions too, especially when they have siblings who are not like them. I have 3 boys, I only have one who's autistic. So, I mean, Derek and Gabriel's not like Gavin. Gavin is different. So it's just making sure that they have the kind of therapy that they need and reinforcing that. Like I'm finding myself now, Derek and Gabriel are gamers. They love their games. They have the newest game systems and they have the newest games. They're gamers, big gamers. Gavin, not so much. Does he play the game? Yes, but is that his number one love? No. So it's helping him find what his number one love is. For example, today it hit me and I was like, well, I remember Gavin asked me for a desk on Christmas and I didn't have anywhere to put the desk. We didn't have anywhere to put it. But I was like, this weekend I'm going to rearrange his room and get some things worked out and get him that desk, because that desk may bring something for him that works for him. Because a lot of times they don't know where they fit. They're that puzzle piece that doesn't quite fit. So they have to figure out where they fit at and what's for them. Key puzzle piece being a symbol for autism. So just kind of helping them through going through those different changes. Of course, my child is older, but even with smaller kids, I feel like they have their own questions and they have their own difficulties and they have their own things that they go through. So I feel like cognitive behavior therapy is a great one. The last one is occupational therapy. Occupational therapy helps individuals in to participate in daily activities and learn new skills to improve independence. Motor skills are sometimes weak. Occupational therapy helps with feeding because some kids are 3 and 4 and not knowing how to feed themselves. Um, they may not know how to hold a spoon correctly, or they may not know how to get the spoon to their mouth correctly. So the food may end up here versus here. So occupational therapy helps with that. It also helps with handwriting. They may not hold their pencil correctly, or they may not I've learned that them coloring in the lines is vitally important these days in kindergarten, I guess, or pre-K or whatever. So them making sure they color in the lines correctly, making sure they hold their pencils correctly, making sure they write their words legibly. That's occupational therapy. Also, I say a lot of times occupational therapy and physical therapy are kind of coincide just a little, not a lot, but just a little. Because what I learned is that a lot of kids who have autism, especially, they walk on their toes. A lot of times people may ask me, because they know that, I dive into it a lot. So they may look at me and be like, hey, do you think my kid has autism? First thing I do is look down at their feet. And that's just one thing that I key into. Not all kids, but most of them walk on their feet, or they walk on their toes rather. And I pay attention to that. My son walks on his toes. Not as bad as he used to, but he does walk on his toes. So that's one of the key things that they try to dive into in occupational therapy too. Of course, physical therapy carries the load of that because that's physical therapy. But occupational therapy kind of dives into that as well. So they kind of work hand in hand just a bit, not a lot, but just a bit to kind of get those motor skills going correctly. So those are the 4 vital therapies for kids on the spectrum. I looked up some places here in Thomasville. I didn't look outside of Thomasville, but if in fact you want me to look for you, find some places surrounding counties, even if you're on the side of the country, I do not mind taking the time to look up places to help you find these therapies, find these resources to get your child the help that they need, because some parents just don't know where to go. So reach out to me at the end of this video. At the end of any of my videos, I always put the ways to reach out to me. Email me, reach out to me on TikTok, send me a message on Facebook if you know me personally, whatever. I do not mind going and doing the research, going down that rabbit hole and diving into getting you the help that you need for your child. But for this video, I looked up some places here in Thomasville, Georgia. And the first one that I looked at, I hold kind of close to my heart, is Stepping Stones Therapy Services. I hold that close to my heart because that is where I worked. I worked there for about 2 years. So I gained a lot of knowledge. Although I went in with a lot of knowledge, I gained a lot of knowledge there. They offer all of these therapies, but cognitive behavior therapy. They used to have it, but unless they picked it back up after I left, I know it was something that they had to drop. But it's a great place. Great place to take your kids. Great place to get all these therapies. They also have a school. It's a great place for your kids to go. I vouch for them. My son went for cognitive behavior therapy before it was dropped. And if you know me as a mom, I am a hovering mommy. I'm real bad at it. I'm working on it. My husband's helping me through it, but I'm a hovering mom real bad. So trust me, if I allow my son to go, they're good. So they're a good place. But they're one of those places that has many names on their list for ABA therapy. The list is very extensive, it's very long. And unfortunately, if you don't have the resources, if you don't have the funding, if you don't have what you need to keep that afloat, it's hard. So their list is long, but Get your kid on that list. You never know when your kid's number is going to come up. You never know when the resources are going to get better and the fund is going to get better. So get your kid on that list. Don't just say, well, don't worry about it just because they have a list. Or just because they may say, and I have had to say, we have 100 kids on this list. Don't get your kid on that list. I say everywhere they offer ABA therapy, they got a list, get your kid on it. Because whatever comes up, here. Let's go here. So get your kids on that list for ABA therapy if that is a resource that your child needs. The second one I have is Compass Behavioral and Development. I do not know a lot about them. I've heard of them. I've heard a lot about them, but I don't know a lot about them personally. Again, they're located here in Thomasville. What I didn't do is I didn't get any phone numbers, and I'm kicking myself for that. But if you need their phone numbers, if you need a way of reaching out, or you need to know where they are, reach out to me. I can get that to you. But that is Compass Behavioral and Development. The third one I have is Mosaic Psychological Services. I vouch for these people because I went to them for myself. One thing that I feel like we don't talk about a lot, we talk about the kids a lot, but what we don't talk about is what the parents experience and what the parents go through. Because just like your kid is constantly asking, why me? Why did I get picked? The parent is asking, well, why my child? Why did my child get picked? And when I say parents, I mean mom and dad. Mom, dad, stepmom. Everybody's questioning that. So get that therapy. Get the therapy that you need to get through that, because yes, that can be a hard pill to swallow, especially when you hear it the first time. I'll never forget when one of my friends, her daughter got diagnosed. Of course, I told her she had it before she went, but she needed the paperwork. She called me. I don't know. And I told her, dry those tears up, put your big girl clothes on, and let's get this done. Let's get this. You need to do this, and this, and let's get it done. But everybody doesn't have that. So I didn't have it. I had to figure it out. So it's just, also making sure that you sit down with somebody and express yourself. Express what you feel. Get those feelings out. And I also feel like it's also important not just for the parents, but for grandparents, for siblings, for everybody in your village, everyone around your kid. It's important for them to fully understand that kid or those kids, because some people have multiple kids. So everyone involved in your child's life should fully understand who your child is and what your child is going through, and this is why. This is why we have to do this way. This is why we have to do that way, because my child has this, and this is that. That is this. Fully understanding what it is. So, yes, go get that therapy. Go get those feelings out. Go gain that knowledge. Go do it. It's important for everybody as a whole involved in your child's life. The fourth place is the psychological center. That's where Gavin was diagnosed. I know the last that I heard, they lost a lot of doctors, whether it be retiring or going off to do their own ventures. But I do know they still have doctors there. They were a great place. So that's also a great place to send your kids to get the help that they need. I don't know exactly what all therapy services they offer. I do know that ABA therapy was one, but I don't know each and every service that they offer. But that's the psychological here in Thomasville. And the last place, South Georgia Autism Center. That is Dr. Graves' office. Dr. Graves diagnosed Gavin. So Dr. Graves will always be held close to my heart when it comes down to this topic. Not only because she diagnosed my son, but because she also has autistic kids. So I always say it's one thing to give me your book knowledge, but it's another thing to give me your experience. I can listen to your book knowledge all day, and I'm not knocking the book knowledge at all, because it's vitally important. You need to know what you're talking about. But at the same time, having that knowledge of experience is great knowledge. And I love that knowledge because you're giving me something that you've experienced yourself. So her knowing and living it, that to me is vital, which is what I said on last week about Gavin's doctor and him having a daughter that's autistic as well. You give me stuff from your stand, not from just your viewpoint of a book, but your viewpoint of what you live daily. So, again, that's South Georgia Autism Center here in Thomasville. That's Dr. Graves' office. She's a great doctor. She's great at what she does. She also offers, I think, most of these therapies. I'm pretty sure she offers most of these therapies. So, um, reach out to them. And hey, like I said, if you want more information on any of these that I named, reach out to me. I put Stepping Stones #1 and Dr. Graves #5 because those are the two that I wanted to highlight, because they in some way hold a piece of my heart. So those were the 5 that I wrote. Not gonna hold this video long. I just wanted to kind of dive into some therapies and some resources. And again, if you want more information, reach out to me. I can always get that information to you. I do not mind going down a rabbit hole. I do not mind. So just reach out to me and I can get that information to you with no problem. That's gonna wrap up episode 3. I am drained because, as I said, this is the third take of episode 3. But I was not gonna go to bed without making sure this wasn't done. Um, I'm delayed a little bit because I wasn't feeling that great, but I'm back and I'm better. So I hope I've helped someone. I hope through this process, even through episode 1, 2, I hope I've helped someone in some kind of way. And again, please, please, please like, share, subscribe, and get it out there because I want to help as many people as I possibly can. That was my purpose for doing it. When God dropped this in my lap, yes, He literally dropped it in my lap. I had to do it. There was no options. There was no choices. I had a push from my husband and a push from my first lady. My first lady actually named it. So I had to do it. And I can't get this done. I can't reach people without your help. So please help me. Help you help the people. Please. That's going to be it for episode 3. Thank you so much for tuning in and good night.